Hi, I'm Dr. Herbert Loong from the Chinese University of Hong Kong, and I'm here to bring you updates from oncogene-addicted lung cancers, of which the abstracts were presented at WCLC as well as ESMO 2024. The first study is the Global Trust 2 study, which is a drug known as taletrectinib in patients with ROS1 positive non-small cell lung cancer. There were two cohorts in this study, including patients who have had prior treatment as well as patients who are treatment naive. The primary endpoint was objective response rate, and in actual fact, the response rate was at 85% in patients who had no prior treatments, and patients who had prior treatments had a response rate of 62%. There was also very good intracranial response in both of these patient populations. The main side effects of this drug is mainly of gastrointestinal toxicities, including nausea, diarrhea, and vomiting, as well as some grade 1 liver dysfunction, and all of these actually resolved with dose hold as well as dose reduction. The second abstract I would like to discuss is an abstract of a KRAS G12C inhibitor, a second generation version of a drug known as colomorasib, in combination with pembrolizumab and chemotherapy. This was a phase 1b study that was conducted, and in actual fact, the specific cohort of patients who were treated in this combination was reported at WCLC. This was a relatively small cohort of only 21 patients, and the majority of these patients had PD-L1 of less than 1% or 1 to 49%. The most common adverse events were cytopenia, and the response rate in the study was 50%. The plan is to have a global phase 3 study of this particular combination, and the first-line Sunray-01 trial is currently ongoing. There is also a specific cohort for patients who are PD-L1 more than 50% to get a chemo-sparing treatment regimen. The third abstract is a study known as Destiny Lung 03, Part 1, which is the study of trastuzumab deruxtecan as a monotherapy in HER2 overexpressing non-squamous non-small cell lung cancer. And this was presented by Dr. James Yang on behalf of Dr. Planchard and colleagues. This was a phase 1b study of HER2 overexpressing non-squamous non-small cell lung cancer defined by IHC of either 2+ or 3+. And in patients who were treated with the monotherapy, in total 31 patients was actually recruited. They actually have had to have at least 1 to 2 prior lines of treatment before entry into the clinical trial. The objective response rate was about 44%, and there's a good duration of control at 12 weeks, and a median duration of response of about 11 months. It was interesting to see that there was better overall response rate in patients who had HER2 3+ disease than patients who had HER2 2+, and also for patients who had prior treatments with EGFR TKIs. Interestingly enough, because of the fact that we have trastuzumab deruxtecan on the market already, this is also a good way to look at the safety signals, and there are no new safety signals within this clinical trial. Next, I would like to discuss 2 abstracts that were presented back-to-back at WCLC, and these are in HER2 mutant non-small cell lung cancer, both the SOHO-1 trial as well as the Beamion Lung 01 trial. And in actual fact, both of these are potent oral tyrosine kinase inhibitors with good activity against HER2 mutations. In both of these trials, it showed a similar objective response rate in their study of essentially above 70%. Some differences in toxicity profile were noted between these 2 compounds though. The 088 compound actually has significant EGFR inhibition on its design. So therefore, in actual fact, there are higher reports of, say, diarrhea and skin rash. Whereas in the zongertinib compound, there does seem to be slightly more patients with ALT or AST changes. But again, both of these toxicities were actually well managed with dose reduction as well as dose hold. Both of these compounds are being investigated in large randomized phase 3 trials in the first-line setting against our standard of care treatment for this patient population, which is chemo-IO. Now coming to ESMO, in actual fact, I've highlighted 2 main abstracts. One is the ALCOVE-01 trial, which is a compound known as NVL-665, a 4th-generation ALK inhibitor in patients with ALK-positive lung cancer, presented by Dr. Alex Drillin on behalf of his colleagues. Essentially, NVL-665 is an ALK-selective, TRK-sparing tyrosine kinase inhibitor with good anti-ALK activity, as well as sparing the TRK activity, hopefully reducing side effects, as well as leading to better tolerance. In the clinical trial, the maximum tolerated dose was actually not reached, and the recommended dose for treatments and further expansion was 150 milligrams daily. And in the study that was presented by Dr. Drillin, in the overall population, the response rate was about 38%, Specifically in patients with the G1202R mutation, which are notoriously resistant to first or second generation TKIs, the response rate was up to 71%. The efficacy was seen in patients who have or have not had prior exposure to lorlatinib, and the median duration of response was 14.4 months in the overall population. Another metric that's been used to study this trial is looking at the duration of response percentage at 6 months, and this was upward of 75%. And it's very important to note that, of course, this drug has very good CNS activity as well. The last abstract I would like to discuss that was also presented at ESMO 2024 is an abstract looking at the mechanisms of resistance to first-line amivantamab and lazertinib in patients who were recruited into the MARIPOSA trial. And this was presented by Dr. Benjamin Bess. Essentially, just to recap, MARIPOSA is a first-line study of amivantamab and lazertinib versus osimertinib in patients who have EGFR-positive non-small cell lung cancer, and we know that there is good progression-free survival benefit with the combination. The data on the mechanism of resistance was presented at this meeting, and in actual fact, blood samples were collected at baseline, as well as at end of treatment, and subsequently analyzed by the Guardant 360 NGS platform. An analysis of 256 patients, accounting for 56% of the patients in the osimertinib arm, as well as 53% of the patients in the combination arm that were matched, had baseline as well as end of treatment ctDNA. Of note, MET amplification was actually found to be threefold lower in patients who were treated in the combination, as well as the fact that if we look at the number of secondary EGFR mutations, it was actually eightfold lower in patients treated with the combination. There were no increase in other mutations, and lower rates of TP53 or RB1 loss was actually noted in patients who were treated in the combination. In summary, these are very exciting times for drug development as well as precision oncology for lung cancer. Identification of targetable biomarkers of newly diagnosed advanced non-small cell lung cancer patients have become more crucial than ever, and it's very important for us to consider upfront next-generation sequencing for our patients. We look forward to further readouts of other potentially practice-changing trials in the near future. And should you have any other queries or would you like more information about today's presentation, please go to the Cohort Ed website to download the necessary materials. Thank you very much.